Hello everyone, we are the Group 5.
I am Johnson T. Sumadja.
And I'm Charles Dan Sigapisa.
And I'm TJ Apinan.
And I'm Dexter G. Martin.
I'm Gino Silimar Kulungoy.
I'm Armando G. Ogo Jr.
And I'm Crystal Jean O. Peralta.
And we're going to discuss the superior anatomical direction of the muscular system. Here in our presentation, we only focus to the four types of muscle in superior or upper section of the human body. And they are trapezius muscle, deltoid muscle, subscapularis muscle, and the arm muscle.
And now, we're going to explain the trapezius muscle.
And its origin, insertions, and actions.
The trapezius muscle is a large, paired muscle located in the upper back and neck area. It takes its name from its trapezoidal shape when fully developed. The main function of the trapezius muscle is to move and stabilize the shoulder blade. It allows for movements such as shrugging the shoulders, pulling them back, and tilting the head to the side.
It originates from the occipital bone at the base of the skull, the ligamentum nachii in the spinous processes of the cervical and thoracic vertebrae. Trapezius muscle inserts onto the spine of the scapula or shoulder blade and the lateral third of the clavicle or the collarbone. The main action of the trapezius muscle are to retract the scapula, pull it toward the midline of the body, elevate the scapula, raise it upward, depress the scapula, lower it, and rotate and tilt the scapula to allow for full range of the motion in the shoulder joint. Additionally, the upper fibers of the trapezius help to extend and laterally flex the neck, while the lower fibers help to stabilize and support the weight of the arm. And now let's proceed to explain the deltoid muscles.
The origin, insertion, and action.
The deltoid is a thick, triangular shoulder muscle. As you can see, a origin of the muscle comes or starts here in the clavicle and also acromial and spine of scapula and goes all the way to insert the part humor called the deltoid tuberosity. The axillary nerve, this nerve can you see, the highlight green is responsible for innervation of the deltoid muscle. There are many functions connected to the deltoid. One of them is the one that you can see now in the screen, which is flexion of the shoulder. This also involved in rotation of the arm, abduction of the arm, and extension.
And the next is we're going to explain the subscapularis muscle.
And its origin, insertion, and action.
The subscapularis muscle lies at the anterior surface of the scapula. It originates at the subscapular fossa, specifically the medial and lower two-thirds of the groove on the lateral border. The muscle's transition to a tendon which inserts on the lesser tubercle of the humerus in front of the joint capsule. The subscapularis muscle is typically innervated by two distinct nerves, namely an upper and a lower subscapular nerve, both originating from the brachial hallux. These two nerve branches cross the axillary vein dorsally to reach the subscapularis muscle. The subscapularis muscle's primary function is internal rotation but can also aid in adducting the humerus. The subscapularis nerve innervates the muscle. The subscapular artery provides blood supply and lymph drainage flows into the axillary nodes.
And for the last one, I'm going to explain the arm muscle and its origin, insertion, and action. Arm muscle is a group of 5 muscles located in the region between the shoulder and elbow joints. But here in our presentation, we only focus to the 2 types of it, and that are bicep brachii and tricep brachii. The origin of bicep brachii is tubercle above glenoid cavity and coracoid process, and the insertion of bicep brachii is radial tuberosity. On the other hand, the origin of tricep brachii is posterior or back surface of the humerus, and the insertion our tricep brachii is olecranon process. The action for bicep brachii is flexion of the forearm, wherein we can see here that the biceps contracted while triceps relax. And the action for tricep brachii is extension of the forearm, wherein we can see here that the triceps contracted while biceps relax. And that's all for our presentation. Thank you for watching.